Hey family, it's Dr. Yola. I wanted to come to you to specifically talk about our children, how our little ones being affected by COVID-19, especially given the fact that we just lost our first pediatric patient here in Maryland to complications from COVID-19, a 15-year-old who developed what has been described as a mysterious illness in the pediatric population. And for those of us working in medicine, particularly in pediatrics, it isn't as mysterious as it's being described. Clearly, there's some still unknowns about how COVID-19 is impacting our children, but when it comes to something called Kawasaki disease, it's something that we have been familiar with really in all of our training. Kawasaki disease is an inflammation that affects our small blood vessels like our coronary artery, the artery that supplies blood directly to the heart muscle. And although Kawasaki disease is a well-known disease process within pediatrics, this particular disease process, as it relates to COVID-19, is still we're still figuring it out, right? It is now being called the Pediatric Inflammatory Multisystem Syndrome, PIMS for short. It has aspects of Kawasaki, but it is not straightforward, which is making it even more concerning for us in medicine, particularly in pediatrics. So what I want to first do is give you some information about Kawasaki disease so that you have a clear understanding and can recognize the symptoms if your child develops them. So what we know Kawasaki disease to be, as I mentioned before, is an inflammatory process that affects the small blood vessels, like your coronary artery, the blood vessels that provide blood to your digestive system, your stomach, your intestines. It usually affects children under the age of 5. So the fact that a 15-year-old developed these symptoms is very concerning because, as we've known with COVID over and over again, there's a lot of unknowns. And so it isn't as straightforward as we in the pediatric world have been trained to recognize. So it's important for parents to be able to identify the symptoms, and important for us in healthcare to be able to recognize the symptoms as well. So let's talk about the symptoms of Kawasaki disease, because we're seeing components of that within this PIMS process. With Kawasaki's, there's usually fever, relatively high fever, 101 or higher, but I don't want us to stick to that because even with COVID-19, we were telling people high fever, but we don't necessarily manifest high fever. But usually with Kawasaki disease, it's fever of 101 or higher for at least 5 days. Children will also develop a rash, usually a pink rash, localized to their stomachs, their backs, their arms, their legs, and their genital area. So pay close attention to that, especially as we're lifting these stay-at-home orders. Children are outside. They may develop a sunburn, rash as a result of exposure to the sun. So it's important for us to make sure that we're wearing things like sunscreen so that the clinical picture is not confused. But you usually will notice a fine red rash on the belly, the back, the arms, the legs, and the genital area. The second thing that you will notice is bloodshot red eyes. Not in your typical conjunctivitis pink eye kind of way with crusting and tearing. Their eyes will just be red, and that will clearly be concerning to you. They'll have tender, swollen lymph nodes in this area, what we classify as the cervical lymph nodes. They may have dry, cracked lips, sometimes swollen lips. They may also have what we call a strawberry tongue. So if you are practicing good oral hygiene, your tongue should be nice and pink. But with Kawasaki, you can sometimes get a white coating on your tongue with red dots. It almost looks like a strawberry. That's why we call it a strawberry tongue. So, and then lastly, you'll have swelling of the palms of the hand and the soles of the feet, maybe even with a little bit of discoloration. So those are the standard initial symptoms of Kawasaki's, and Kawasaki usually manifests in 2 phases. The first phase includes the symptoms that I just described, and that lasts for about 2 weeks. And in the second phase of Kawasaki, usually little ones will have joint pain, they'll have nausea, vomiting, and diarrhea. They will also have belly pain because, again, this is an inflammation of the small blood vessels. But we want to catch it during phase 1. Because if we do not catch it during phase 1, it increases the likelihood of complications, the most concerning of which is something called a coronary artery aneurysm. It's an outpouching of the blood vessel wall that increases the risk of the blood vessel breaking, rupturing, and then blood flowing out, hemorrhaging, right? But you won't have extensive hemorrhage. What it ends up doing is impacting the heart itself because the coronary artery, as we've mentioned before, supplies blood to the heart muscle. That's worst case scenario, is a coronary artery aneurysm. and it rupturing, which is why it's important to recognize the symptoms. But you can also have other complications in terms of the interruption of the blood flow in the coronary artery. It will affect the muscles of the heart in terms of its ability to live and function. You can also develop arrhythmias, abnormal rhythm of the heart, because again, when you impact the blood flow to the heart muscle itself, it will affect how well the heart receives the electrical impulse to cause it to beat. So those are the reasons why we want to pay very close attention to this PIMS, this pediatric inflammatory multisystem syndrome. What we also want to make sure that we're doing is advocating for ourselves. If you're concerned that your child has these symptoms, make sure that you reach out to your healthcare provider. Reach out to your pediatrician. If your child does not have health insurance, go to auntbertha.com. That website will help navigate you through to, one, a healthcare provider who does not necessarily require insurance, and two, to help facilitate you, your little one, getting insurance. It's important for us to be able to diagnose it as early as we can to decrease the risk of those complications, because Kawasaki disease requires hospitalization and specialized treatments. It's not something that you can treat at home. This isn't one of those random viral rashes that, we'll tell you to put some hydrocortisone on, take some Benadryl, and call it a day. This is a medical emergency if your child develops these Kawasaki-like symptoms, all right? If you have any questions, do not hesitate to reach out to me. I'm always available. Feel free to go to my website, askdryola.com. I will be talking about this in a Facebook Live on Wednesday, so make sure to come tune in so that we can talk a little bit more about how the pediatric population is being impacted. And remember, historically, Kawasaki disease was in our little ones under the age of 5, but clearly, given the fact that we just lost a patient this week to these Kawasaki-like symptoms, this PIMS, we have to pay attention across the board. It also means that we cannot say that our vulnerable populations are simply the elderly, those with chronic diseases, and those who are immunocompromised. One of the challenges when we start thinking about COVID-19 in only at-risk groups, particularly as we're removing these stay-at-home orders, is that we stop thinking about the fact that everyone is at risk. COVID-19 is an equal opportunity infector, and clearly it is causing devastation. Not wide scale, but enough. Like, I don't want to risk my child. I know there are conversations about children going back to school sooner rather than later. We're not rushing our babies back to school. They are not expendable. They are not disposable. Put a mask on your child and advocate for your child. There should not be a rush. The more we rush our children into these unsafe spaces and we consider them at low risk, the more of these cases that we're going to see. And clearly, when their hearts are literally at risk, we can't take the risk of rushing our children back into school and back into society. We have to protect our little ones. That's part of my job as a mother and as a pediatrician. All right. Any questions, do not hesitate to reach out. Dr. Yola out.